Pelvic pain syndromes tend to happen to the brightest and most accomplished of people in the society, the overachievers who carry all kinds of responsibilities, doctors, lawyers, engineers, investment bankers, programmers, CEOs, are commonly afflicted with this problem. The biggest suffering in pelvic pain syndromes that we treat is not the physical part of it. Certainly it's uncomfortable and no one would want it. But if you knew that your physical symptoms would be better tomorrow, it wouldn't really bother you so much. You tolerate the discomfort and you would feel okay in the knowledge that the symptoms would go away. Just like having a cold or cutting yourself, you have a certain kind of faith that you'd get better. What happens with pelvic pain syndromes is that when it doesn't go away, it's the thought that it's never going to go away, and what is my life going to be like if my pain and my symptoms don't go away. That is really the biggest suffering. And the Stanford protocol really addresses both the physical and the psychological components of pelvic pain syndromes. Both are absolutely essential to deal with. If you only deal with the physical symptom, the psychological context in which they occur will cause the body to tighten up, generally speaking. And you might have some temporary relief just by working on the physical symptoms, but the whole attitude that created them is not addressed. It must be addressed. And that's why we teach people a method of regularly, daily relaxing the pelvic floor, quieting down anxiety and quieting down the tendency to tighten up the pelvic muscles under stress. We teach people how to themselves release their own trigger points and their own areas of physical restriction. When you know that there's something that you can do to help yourself, even when a stressful situation arises and you begin to have symptoms, knowing that you can do something about it is everything. It's typical for someone who comes to see us to have had some kind of significant and ongoing stress in their life for a certain period of time, which seemed to be coincident with the beginning of their symptoms. But even when this stress stopped, the symptoms continued. In fact, this tension, anxiety, pain cycle tends to have a life of its own. It tends to go on, even when the original trigger goes away. People often ask, is there a cure? Is there any hope for me? And people who ask this are usually people who've been depressed and hopeless for a long time. We have helped people significantly reduce their pain and their symptoms, and we've helped some people become pain-free. I don't like to use the word cure because under periods of stress, this problem can reoccur. Now, our protocol is aimed at giving our patients the tools to reduce or stop the flare-up once it does occur. And when you know that there's something that you can do about the problem itself becomes much easier to deal with. We have inquiries from women about whether the Stanford protocol will help female pelvic pain. In fact, from our point of view, muscle-related pelvic pain in men and women is essentially the same, and the treatment is the same. And our protocol works both with muscle-related pain in men and women. The Stanford protocol is what we have called the slow fix, not the quick fix. When people come to see us, we tell them that they're going to have to do the physical therapy, self-treatment, and the relaxation protocol at least an hour and a half a day for many, many months, and then in a maintenance way on an ongoing basis. If someone is not prepared to do that, they probably aren't a good candidate for our protocol. Just like you would not hire somebody to brush your teeth to keep your teeth clean, in the same way we look at taking care of the pelvic muscles that have tended to be chronically contracted, that is something that you as the patient have to do yourself. We've just released the 5th edition of our book, A Headache in the Pelvis, and in it we describe who our protocol is most likely to help, and we describe the details of our method.